Hello, my name is Marco Brindis, and I'm here for an expert tip. And we have been talking about bonding zirconia, bonding restorations to the tooth, and pretty much we all know the protocol. However, from time to time we have different challenges. So there are two main challenges. So my first tip is the challenge that how do we prepare the surface of the restoration, how we clean the surface and prepare the surface to have the optimal level of bonding, all right? So you know the steps, you try it, and after you try it, you put the ultrasonic to clean the oils and all the proteins from the saliva, but then you have to prepare the surface to create mechanical retention, and that's with a micro-etching with aluminum oxide, right? We all know that. Now, everybody knows that. What we don't know is, like, have you ever been preparing the surface and you don't even know if the powder is coming out of the thing? So the first thing that you test, I always have like a printed model, and I start trying to see if he's actually doing something, because you don't know. Because once you put it in zirconia, you really cannot see if he's treating the surface or not. So one of the things that I would recommend you to do is recommended to do it for at least 5 to 10 seconds each surface. That doesn't mean that it's going to take you 10 seconds to clean one restoration. It might take you a whole minute. So if you really need to know if you're actually cleaning it, what I do is I get a Sharpie and I paint the inside of the restoration, and then you have a guide of what surfaces you have treated so far, and you can actually take control on how much time you're spending, the 10 seconds that you need on each surface, because you're cleaning off all that Sharpie out of the restoration, and that way you know that you treated the surface properly. That's my first tip of the day.